I'm going to go ahead and introduce Jenny Sullivan, who's joining us remotely from Washington, D.C. She's the director of the Best Practices Institute of Enroll America, which is an organization that aims to ensure all Americans get coverage. Jenny, go ahead. Thanks.
Great. Thanks so much, Danielle, and thanks so much for having me join you today. It's my pleasure. So what I want to talk about today is, now that the election's over, where is Wisconsin headed? Where is the rest of the country headed, specifically with respect to health coverage? So I know there's a little bit of a delay between what I'm able to see remotely here on the slides and where you all are at, but I'm going to move to my second slide. It is a little overview of Enroll America. I just wanted to get a little better sense of who we are. We are a relatively new national organization, and we just launched last September. And we have the unique, singular focus that we want to make sure as many people as possible are connected to the new coverage options that they will be eligible for starting next year. We want to make sure that once they're connected, they stay enrolled. Our strategy for achieving this goal is twofold. Number one, we work on promoting best practices, which is the operation that I am on, and that's really thinking about both from the consumer's perspective as well as from state and the federal government's perspective. How do we make sure that these systems really will work well for consumers? How are we going to make sure that people can navigate through a system and figure out what their health insurance options are, what kind of assistance they're going to be eligible for, and connect to the plans that make sense for them and their family members quickly, seamlessly, in a way that it makes sense and feels like they're making well-informed and trusted decisions. And then what does the back end of that process look like for, like I said, the government stakeholders who are sort of building this system? And then how do other stakeholders, like many of you on the call today, participate in that system and work together to make sure that it works really well for folks? So that's really the best practices part of our strategy. The other part of our strategy is about raising public awareness. If we build a really good system and nobody knows about it, then we haven't done a very good job. So we're working very intensively right now with a couple public relations and research firms to really figure out what the best messages are to communicate to all of the new people who will be eligible for coverage, probably for the first time. What messages are going to drive them to take that extra step to enroll in coverage, to seek it out for them and their family members? What information do they need? What messengers are they going to trust? And how should this all work? So we are working in this sort of bifurcated strategy, and then weaving it all together, we do state assistance work. So sort of like I'm doing today, really talking with you all in Wisconsin. But we're really actively working with partners in a wide range of states from all different perspectives that are in all different places with respect to the health reform law, thinking about how this works, how we get diverse stakeholders to the table. And that's the one other thing that sort of makes Enroll America very unique. We have 55 right now. I think we just ticked over to 55 within the last few days, national partners who come from all over the health insurance coverage and the health policy really gamut. We have organizations that represent providers, hospitals, health insurance companies, retail pharmacies, pharmaceutical vendors, consumer groups, groups for individuals with specific kinds of diseases, civic organizations, etc. And if you have lived through the health reform debate, you know that these organizations don't agree on very much. But what we have found is that they do agree on getting as many people connected to coverage as possible. For some of them, it's an altruistic mission. For others, it makes business sense. But regardless of their motives, they've come together and said, yes, we want to be part of this effort to get as many people connected to coverage as possible. Next slide. So the ACA is here to stay. We call it the ACA here in our office, but as Roberta mentioned, there are really quite a few names for it. But what does this really mean for Wisconsin? And that's what I hope to talk a little bit more with you about today. What does it mean for the state? What needs to happen with coverage between now and next fall, when open enrollment starts for health insurance exchanges, and by next January, when the Medicaid expansion will take effect in the states that choose to take that up. And then finally, how is Wisconsin stacking up against some of the other states around the country that are trying to make progress on this front, or in some cases that are a little bit slow to make progress? So really, this is about we spent the whole last year thinking, well, what if? What if this happens with the Supreme Court? What if that happens with the election? And now that we are on the other side of some of these major decisions and uncertainties, we really need to start talking about how. And that's what I hope to cover today. Next slide. So really, I think you're going to get a lot of this today, I suspect, but I just wanted to reiterate sort of the national vision for a seamless continuum of coverage. That is the goal. That is where we hope to head as soon as 2014. And I think that we know, experience shows us that this will only get better. There will be bumps in the road, but we will be on a path to this vision of a seamless continuum of coverage with a strong foundation of Medicaid for the most vulnerable populations and for those with the lowest incomes. And then on top of that, we have these health insurance exchanges available to essentially to everyone else who doesn't have an affordable offer of employer-based coverage. For those who don't have or whose income is below 4 times the federal poverty level, they will be eligible for some federal tax credits that will come in the way of basically a discounted premium when they go to purchase their private plan. So make sure that we're all on the same page with what these exchanges are. On the consumer end, it's going to feel a little bit like a website. It might feel a little bit like an Expedia or a Travelocity. But really what's going on the back side of that is very complex and sophisticated, and it's really sort of a regulatory body that makes sure that the insurance products that people can buy from the exchange are high quality. And there's different ways to design that exchange, and states have a lot of options, and then essentially the federal government as well if they're coming in to create the federally facilitated exchange. But generally it's a marketplace where people can buy private plans offered by some of the same names that you all get coverage from today, but they'll be able to get tax credits to help with the cost of premiums if they do have an income below 4 times the poverty level. If their income is higher than that, but they still don't have affordable coverage through an employer, they can still purchase a plan on the exchange and have that sense of confidence that it is a good plan, it is covering the essential health benefits, and it will be there for them no matter how their circumstances change, no matter how much their job changes or where they go. So that's sort of the national vision of where we hope to go. Next slide. So what we really want to talk about at Enroll America when we think state to state is what is the enrollment opportunity in states? We know that we're probably not going to be able to enroll every last uninsured person, certainly not in the first year. Even programs like Medicare, where eligibility is universal across the country, don't have 100% sort of take-up. People have the option to participate in these programs or not, and it takes a lot of work to get a robust participation rate. But the opportunity in Wisconsin is really looking at that sort of big picture of how many people in this state are uninsured and might be eligible for some of these new options. And I do apologize to folks today. There were new numbers that came out earlier this fall, and I failed to update my Wisconsin slides to reflect those. So the proportions are relatively similar, but basically about 47% of the uninsured in Wisconsin may be eligible for Medicaid if the state chooses to take up the Medicaid expansion option. Another 40% of the uninsured in the state will be eligible for that premium tax credit to purchase coverage through the exchange. And then finally, a smaller proportion, about 13.5%, will be eligible for exchange coverage that they will just pay the full cost of their premiums for. So this is the vision of how far we could go. And hopefully these numbers won't grow so much more over the next few years so we can continue to whittle away at them and get more and more of these roughly 500,000 people connected to coverage in the state. But in order to do that, of course, we have some challenges. Next slide. And one of the chief among those is that there is extremely limited awareness when it comes to these new coverage provisions that are taking effect. 3 out of 4 of those who will be newly eligible in a recent poll said that they don't know anything about health insurance exchanges. They have never heard of this. And we are actually in the process, as I mentioned before, in terms of informing our public education campaign. We have been doing a lot of research both through a national survey as well as through focus groups. And the focus groups actually took place last week. So I don't have the full report from those yet, but what I can report is that they really corroborated this 3 out of 4 sort of finding very few people have even really thought about Obamacare, quote unquote, much at all. And if they have heard of it, they're thinking about those provisions naturally that have already taken effect, like staying on your parents' coverage until you're 26. Some folks, that was probably the most popular, followed by the pre-existing condition coverage. But this idea that coverage and assistance is going to be available to people who are uninsured right now is completely off the radar. So we have a lot of work to do, both at the national level as well as I think in different states, different messages and messengers are going to work better. And we need to do a whole lot of work to really build up public awareness that this is even coming. Traditionally, when we talk about outreach messages, we say it takes up to 7 times for somebody hearing the same message before they're actually compelled to take action. And then when you put on top of that folks are going to need to take action to seek out the coverage, and they're going to have to pay for it in many cases. We really need to support people along the way and make sure that they have the help they need and that they're encouraged and continually kept aware of what's available for them. And that's where that second statistic comes in. Again, roughly 3 out of 4 consumers say, when we say, okay, there are coverage options coming. You didn't know that, but here they are. There's going to be some help available for you to pay for this stuff. Now do you think you might want to enroll? They say, yes, we're very interested. We value insurance, and now that I know this is coming, I'm intrigued, but that sounds very hard. Enrolling in insurance, filling out an application for public assistance, a lot of these folks have not been touched by public assistance programs in the past, and the notion that they may need to apply, give information about their income, it sounds bureaucratic, it sounds complicated, it sounds like something that they want a person who's an expert to sit next to them and help them with. And that's where I think really making sure that the assistance is available is going to be key to ensuring that as many people as possible connect to these new options. Next slide. So backtracking a little bit and thinking about the timeline, we are 315 days away from the beginning of open enrollment for health insurance exchanges. It's a little bit scary. We're less than a year away, and there's a whole lot of work to do. I'll show you in a few minutes where different states are. And Wisconsin may not have made a lot of decisions yet, but it's not alone. And the thing that Wisconsin does have in common with every other state in the country is that it will have a health insurance exchange that will open its doors and begin accepting applications October 1 of next year. So how are we going to do that, and what's that going to look like in Wisconsin? Next slide. And just so it looks like we're a little bit behind still, but I'm on slide 8, just so that you all know back there. So the coverage continuum in Wisconsin. It looks like this is actually a Wisconsin-specific picture of one of Roberta's slides from earlier. But it really just shows kind of where coverage is right now for children, for pregnant women, for parents, and for adults who don't have dependent children, young children at home. There's a good safety net, a solid foundation of a safety net provided through Medicaid and Badger Care in Wisconsin. And Wisconsin has historically done very well and has very generous coverage in that regard. But we're going to layer on sort of this exchange with tax credits over the top and just sort of pour that over the tops of the eligibility levels so that everybody up to 4 times the poverty level has some form of assistance available to them, either through the exchange or through Medicaid. Now, Medicaid isn't going to roll back or lower its eligibility levels. That's going to stay where it is, and the exchange will hopefully pour in over the top of that. And then, of course, like I said, above 400% of poverty levels, 400% of poverty, folks will be able to buy into the exchange if they need to. So, in order to get to this, there are a lot of policy changes that are going to happen behind the scenes. Sorry, next slide. Requirements for all states. There are a lot of policy changes that are actually going to help states get there, help states make sure that they're building systems that are easier for consumers to navigate than they have been in the past. And what this slide really goes through are some of the things that every state has to do, even if it doesn't expand Medicaid, and even if it wants no part of a health insurance exchange and eventually has a federally facilitated exchange. Nonetheless, some of these basic tenets of how somebody enrolls in coverage and connects with it will be in place. Those include, I think, really most notably, a single streamlined application that a consumer can fill out to connect to health insurance coverage. The idea is that there will be one application, and folks ideally will be able to fill that out online, either themselves, or they'll be able to get in-person assistance or assistance over the phone, where an individual will be entering their information into this online dynamic application that will get all of the information necessary from the entire household so that you figure out who in the family is eligible for which kinds of coverage. One of the complicating things about the new continuum of coverage is that you could easily have a family where the parents are covered through exchange coverage, but because of the more generous coverage available for children, the children might be eligible through a different pathway, either through Medicaid or CHIP. That single streamlined application is going to connect everybody in the household to the kind of coverage for which they're eligible, so that families don't have to fill out separate applications for separate family members, or fill out one application, get denied, and have to start all over again. This is a one-time process, and the agencies administering the various programs need to work together very closely on the back end to make sure that these handoffs are as seamless as possible and that people don't fall through the cracks. That's much harder to do than it is to say, but I think it's a very laudable goal, and it's something that states are working very hard to achieve, and the federal government as well. Some of the other tenets that make it a little easier for all states, that have to be available to people in all states, are a new definition of how we count income. It's called modified adjusted gross income. It's really just a way of simplifying across the country what kinds of income counts and doesn't count when we're trying to figure out, okay, what is your income and what kind of coverage should you get? It's not that every state will have the same children's eligibility levels, but rather that they're going to count the money in someone's household basically the same across the country. Some of the other simplifications are, and Wisconsin has really already overcome these barriers, which is an exciting thing, and one of the reasons Wisconsin has historically been such a leader. But we're no longer going to have asset tests when we figure out what kind of coverage someone is eligible for, and we're not going to require them to come in for an in-person interview. Finally, through this online application, it's really going to allow us to use electronic verification instead of requiring families to take that extra step of sending in pay stubs or scanning in information and emailing it. We really want to use the information that both government and private databases have about a person to get as much of that information that way as possible, so that it's the smallest possible burden on families. And all of this is going to make it much easier for folks to connect to coverage. Next slide. So Wisconsin, we learned last week, as states were starting to come forth with their decisions with respect to the kind of exchange that they want to have, we learned last week that Wisconsin is likely to have a federally facilitated exchange. This means that the state is not going to create a state-based exchange. It's not going to be designing how that system works. And it's not taking sort of the middle ground option called a partnership exchange, where the state would say, we'll take on a few small responsibilities, but we'd like the federal government to cover the rest of the process. And some of those responsibilities would either be regulating the insurance market and figuring out how to manage the plans in the exchange, and then secondly, providing on-the-ground assistance and figuring out what kind of enrollment help people will need in the state. Wisconsin has said or your governor has said that he probably would like a federally facilitated exchange, or that's sort of the fallback, because he's not creating one for the state. And so there are a lot of unknowns there, but I think there are a few things that we can trust will happen with federally facilitated exchanges going forward. We know that the federal government is creating that single streamlined application that states can use, and that's what the federally facilitated exchange will use. It will create a website so that people can connect to coverage, and the state agencies that administer Medicaid and Badger Care are going to have to work closely with the federal government to make sure that that application adequately connects or refers folks to Medicaid and Badger Care. The federally facilitated exchange will also handle consumer assistance. They're going to be choosing both quote-unquote navigator entities, which are required by the law. Every exchange has to have navigators to help people apply for coverage and to help them choose a health insurance plan. And then on top of that, HHS might also create a sort of short-term in-person assistance program to really blanket the state with the number of assisters that will be needed, especially during the first couple open enrollment periods in the first renewal period. We also know that HHS will create a call center that they will staff so that folks can get telephone assistance if needed. HHS is creating a public awareness campaign, and we're working closely with them to make sure that our public education campaign is complementary to that. I think we're really going to try and make sure that people just know that something is available to them and understand that insurance is something that they should be trying to seek out. And then if they want to take those next steps, the HHS campaign will come in to really connect people to the specific resources and websites. And finally, one of the basic tenets of the federally facilitated exchange is that state government and private stakeholders should have a voice and should be engaged through the process. And I will say in a minute that I really hope that you all can come together and think more about the kind of feedback you want to be sharing with your federal officials as we're creating this exchange to make sure that it works well for Wisconsin. Next slide. So here are just some action steps. I know it's a little overwhelming to think about where things need to go to prepare for next fall, but there is a lot of work, even though Wisconsin will have a federally facilitated exchange. There's a lot of work that needs to happen on the ground, and there's a huge amount of input that stakeholders need to provide to make sure it works well. So as a group, you really need to think about defining success. How many people are you going to enroll? How many people realistically can you enroll in the first year? Who are the partners that you need to have at the table? Are your coalitions broad enough? Do they reach some of the different vulnerable populations who will be newly eligible for coverage that have never been eligible before? Do you have folks at the table that represent some of the different industries that have their own stake in this that might be willing, if unusual, partners to have? Thirdly, together, developing a vision for what the assistance looks like on the ground is going to be absolutely crucial. Who are the uninsured in Wisconsin? What communities do they live in? Where are the highest concentrations? Where are they going to get information? Who are the best partners? If it's young adults, maybe community colleges are a good place to look. If it's very, very low income homeless folks, you need to partner with some of the shelters and folks in the urban areas. Maybe it's rural outreach, but really thinking about who that population is and which partners need to be pulled in is going to be key. And then finally thinking about how you're communicating the work that you're doing and the goals that you're setting, both with your state as well as federal leadership. Thus far, I think it's been sort of challenging for state partners to communicate with federal leaders if the federal government hadn't been in touch with the state government. There was sort of this workaround that wasn't happening because the federal government, first and foremost, wanted to respect states' flexibility and their authority to do some of this work on their own. Now that it's become clear that a federally facilitated exchange is likely in Wisconsin, I think it really opens up the opportunity to have more direct and ongoing communication with some of the federal leaders who are figuring out how the system might work for Wisconsin. Next slide. So progress in other states. We had a big deadline last week. We thought it would be bigger because states were originally going to have to supply sort of a game plan, a blueprint, if you will, for their exchange. And HHS gave states a little bit of extra time to get those in, so they have until the middle of next month to say whether or not they're going to have a state-based exchange or not. And then they had even a few more months to figure out, okay, are we going to have a fully federally facilitated exchange, or do we want to have some of those responsibilities and work in partnership with the federal government? But even knowing that we've still got some outstanding deadlines, we have a lot more information now than we did. We know that I think 17 officially, 18 is my count based on just some of the work that we've been doing in states. 18 states are going to go for a state-based exchange. 2 states, and those are Illinois and Arkansas, are definitely going to have a partnership exchange, and I think we'll see a whole lot more in that category in the next few months. And then about 9 states are pretty adamant that they will not have a state-based exchange or a partnership, and the feds will be coming in to set up exchanges in those states. Last slide, how are other states coping? I just really wanted to make sure that I left you with some stories of other states making progress and the ways that other stakeholders are figuring out how to grapple with these uncertainties and really move their state forward in a good direction. despite different political realities. So I'll start with Illinois. They have been working based out of the Illinois Maternal and Child Health Coalition. They've been working with Blue Cross Blue Shield of Illinois, as well as Enroll America, to pull stakeholders together. They had an enrollment summit last month that brought a lot of their partners together and really talked about the landscape of the uninsured in the state, the lessons they've learned from covering kids, how existing consumer assistance programs are working in the state, how they see that there are gaps in the system and how they need to be able to better reach special populations looking towards next year. And then finally, talking a little bit about the research Enroll America has done on messaging, which will be more widely and publicly available in the next couple months. Another state that we have been doing a lot of work in is Florida. Florida, like Wisconsin, has not been quick to embrace the Affordable Care Act or take steps to establish an exchange, but their Covering Kids and Families Coalition has been thinking about this for quite some time, and they have officially decided to broaden their outreach planning to other populations and not focus just on kids, but really recognize that with the direction that national policy is going, they want to be able to reach all of the families who need assistance in their state. So they're working to broaden their coalition, to bring in folks like AARP, folks from the broker and agent community, labor, et cetera, so that they're prepared for where they're going next year. A couple more examples. In Michigan, that's one of those states that we thought for a while would have a partnership exchange, although it is not clear now. They may have a state exchange after all. But nonetheless, they have a large, almost 200-member coalition in the state that's been doing a lot of consumer-focused healthcare work for quite some time. And like Florida, they're working to expand their network, but they're really thinking about the ground game. Where are the gaps in the ground game, and what assistance, training, train-the-trainer type tools can they provide to people who may eventually work for or serve as navigators or in-person assisters to provide enrollment assistance. They also may be planning an enrollment summit for sometime early next year. Finally, Georgia is another state that has really not been a huge fan of the Affordable Care Act, and although they were planning to do sort of an Enroll Georgia type effort several months ago, they, after the Supreme Court decision, decided to focus their energies instead on just the Medicaid expansion. They figured with their resources and with their the need in their state, that was the best use of their time. So they're really doing an environmental scan and trying to figure out how to get how to encourage policymakers in the state to take up the Medicaid expansion and really expose the need that exists across the state because their eligibility levels are so low today. So I just wanted to, like I said, close with some concrete examples of how other states are coping with this to give you some ideas of how Wisconsin might think about making progress over the next few months. So with that, I will turn it back to Danielle.
Thanks, Jenny. We did have a number of questions that came in, two of them around two specific themes. One was the role of the navigators, and I know that's a really important issue for a lot of our listeners that are working as advocates and working to help people that are uninsured. So you had mentioned that there will be a number of people that are new to the exchanges that aren't used to navigating this type of landscape, and you talked about the development of these navigator programs. And we're just wondering, a few of the questions were surrounding that, if you know the timeline for the implementation of that program, as far as when these navigator programs will actually be in effect, specifically in Wisconsin, and will things like the call center and the actual navigator program, will they be local because we're in a federally facilitated exchange, or will they be nationally run?
Sure. So as far as the navigator timeline, I think we're going to probably see more guidance coming out about exactly how this program will work, particularly from the federal perspective in the next few months. But navigators have to be ready to function and ready to connect people to coverage by next fall, certainly no later than October 1, 2013. You backtrack from that and you think about the hiring and the training and the outreach that needs to happen, because we ideally would like to see, and this is Enroll America speaking, but we'd like to see navigators able to start getting the word out and talking with folks in advance of that October 1 deadline. We really think that the program should be starting to get up and running early next year. I don't have any solid deadlines right now or solid information about when the state will see more about that from the feds, however. When it comes to call centers, I think the federal government is building the call center capacity for federally facilitated exchanges based on sort of the foundation that they've used for Medicare, which makes sense. That's a national program that they run, and they run the 1-800 number for that. I think they're building and drawing on a lot of lessons learned from that process. But I think it'll be important, and right now we don't know exactly how this will work, to coordinate the telephone assistance that gets provided for exchange coverage with existing telephone assistance that gets provided for local programs or state programs in Wisconsin. Okay. And we've seen, even in states like Massachusetts, that sort of large government-run call centers can coexist with smaller consumer-driven, consumer-oriented helplines in a pretty helpful way, so that consumers can dig deeper and get more assistance by calling that consumer helpline than they might be able to get if they called a large call center that was dealing more with sort of administrative issues. So there's lots of different models to think about there.
Okay. Thanks. And then just one other question, quick. You mentioned at the beginning of your presentation how the insurance plans will offer essential health benefits. Can you just define what essential health benefits are and what they're going to be looking like?
Yeah, sure. So the Affordable Care Act does require individual and small group plans, both inside and outside the exchange, to cover what are called, quote, essential health benefits. And they don't actually, it isn't one plan that every state has to have or offer. It's 10 categories of benefits. I can tick them off real quick, but it's a lot of the basics: ambulatory services, emergency services, hospitalizations, maternity and newborn care, mental health, substance abuse and behavioral services, prescription drugs, rehabilitative and habilitative services, lab services, preventive wellness, chronic disease management, and finally pediatric services, which include oral and vision care. States have a lot of flexibility, which is of course the theme of the day, in deciding how they want to structure that, and there's some different options in terms of model sort of benchmark plans that they can model their benefit off of. If a state doesn't decide what essential health benefit it wants to have, then the federal government default says it's one of the 3 largest small group plans in the state, and the feds would figure out which one of those made the most sense.
Okay. Thanks, Jenny.